Hello, good morning.
Good morning, doctor.
How are you?
I'm all right, thank you.
What seems to be the problem?
Well, doctor, it's my daughter Jessica. She has been constipated for 5 days now, and she was in so much pain this morning, and she was tearful because she cannot pass any stool.
I see.
And this is after we came back from hospital. She had her tonsils removed.
Really?
Yes, and then well, I thought maybe because she's not eating enough, as she's not
The
passing
pain of
any.
the
Uh,
pain of
that's right.
truth, yes? Well,
What do
I
you
see.
think? Do you think that
Uh,
is the case?
before I started, how old is she?
Oh, she's 9. Jessica's
She's
9.
9.
Yes.
Okay. And what type of painkiller is she taking?
She takes something called oxycodone.
Oxycodone, yes. And apart this pain, apart this bad, uh, uh, apart this constipation, has he had other symptoms
No, she
like
hasn't.
any vomiting?
No, she hasn't. She just had this pain, which was better with the painkillers, but yeah, just a constipation.
Uh, okay.
And she
Uh,
hasn't been
uh,
eating really. She hasn't been eating much because of the pain in the throat.
Yes, I see. And how many tablets is she taking in a day?
I think they said I can give her a half tablet every 4 hours. So that
Every okay, I think it's too much for this age, and it can be related this constipation with the amount of these drugs. Is that
okay.
all right?
Right. So you mean the painkiller causes the constipation?
Uh, it can be related, yes, because and I think when we reduce the amount of this tablet, this constipation is resolved. Don't worry about that.
Okay. So
Yeah.
why do they prescribe this? If it causes so much constipation, they could have given her another painkiller, which is less constipating.
Uh, uh, well, at the first of the remove of tonsil, the pain is high, and maybe her doctor prescribed this tablet. And I don't worry about this. Now you can decrease the amount of this tablet, and because of short life of this tablet, it's this is a common side effect, and this side effect is very short effect.
Okay, so
Don't worry about that.
it doesn't last long. Okay, okay.
Yes.
So, doctor, do you think gargling with salt water is helpful for her?
That's a good question. She can use gargling, but it's very important to not swallow this solution. Yes.
Okay, right.
Uh, are you with me?
Yes, yes, I understand. Yes.
Okay. Okay.
And okay, and should this be? Should I put a lot of salt in the water?
Yes, uh, because of this, should a lot of salt. It's very important to not swallow this solution.
Okay, okay.
Yes.
And is that okay if I give her some ice cream?
If her eating, it's not problem. Ice cream can heal it can heal. It's useful for you if he can eat.
Okay.
Is that right?
Yeah, it's all right. Yeah. She can swallow now, but she is more comfortable with anything cool, and that's why she wanted a lot of ice cream.
Okay. It's very important to know that this process it will go away after few days, and she can use a simple painkiller like paracetamol.
Okay.
This pill doesn't have any side effect, for example, a constipation. And
Okay.
I can assure you that this side effect can be removed after few days.
Okay.
Yeah,
Okay. Thank you, doctor.
you're welcome.
Is there anything we could do for the constipation now?
It's not necessary. I think if she can drink a lot of water and reduce the dose of this oxycodone, I think after few days it will go away.
Okay.
Yes.
Okay. Thank you.
Is there anything else you'd like to ask me?
No, that's it. Thank you, doctor.
Okay.
Goodbye.
Goodbye. Goodbye, Jessica.
Bye.
Bye.
Okay. So how was that?
Not bad. Okay.
Good. Okay. Not bad. Okay. What score would you give yourself?
6 out of 10.
6 out of 10. Okay. And so, what went well? I mean, after you actually, after you froze after that, then what went well? You had a little bit of problem with the rapport to see with a scenario basically to see whether you know the patient
Yes.
or not. Yeah. Okay.
Yes. And I always be confused when the scenario is the parent come with a child,
Right.
and I don't know. Do you greeting with the child? Do you greet with the child or not?
Well, yes. You certainly need to. We say you need to acknowledge them. Basically, you need to, especially if it's an older child, because
yes, she's 9 years old, and
yeah.
I connect with him, but with her straightforward.
Yeah. I mean, it's if you're not sure, you just need to basically just address and acknowledge that. Okay. So if it's 3 or 4 years old, they don't understand saying hello. You just say hello. How are you? And you need to know the name. For example, say hello, Jessica. How are you? And yes, we basically we need to say hi to them. Yes.
Okay.
Okay. And then whatever is written in this first part, is known by you. Okay, this is your information. So, I mean, in reality, in this case, I mean, this is an old case because there is no information gathering, as you can see. So it says that the daughter here is here, underwent tonsillectomy a week ago, so you know all of these. The doctor has been using oxycodone, and then constipation, and no history of severe constipation. You have already examined the child. So basically, this part is all about information giving, and that's why I'm saying it's an old role play. Okay, so yeah, but I mean, basically, yes, this is what is known by you here. Right, the setting is suburban clinic. You say, usually we say, ask the examiner, what is the patient's name, or do I know the patient's name, for example. If they say no, this means that it's the first time you're seeing this patient, so you introduce yourself. Okay?
Yes.
Okay, so you can explain, because it's a suburban clinic. Should I do I know their name? Do I know the patient's name? And if they say yes, this is the name, that's fine. If they say no, you don't, then you say, okay, my name is Dr. and how may I address you? Okay.
Okay.
Right. Okay. So back to the reflection. So what went well? Rapport, then information gathering. You said how long has she had it, and then okay.
About the type of tablet and
Good.
the type of tablet, how many times is she using this tablet? I think it's enough for information gathering.
Right. You had good structure.
Not bad. Yes.
Okay. So exploring eyes and information giving.
Yes. Explore eyes. Yes. Because the problem is clear. The relationship between oxycodone and constipation, and I try to manage that.
Okay, good. So what could be done differently? Because you actually you've you lost 4 marks here, so it means that you think it was not as good as the previous one. So what could be done differently?
I'm not satisfied generally because I've distracted, but I try to present well. Please help me to
Why you're not happy? Okay.
Yes. No, you're not happy. Because if I'm thinking about why I have 6 out of 10, I don't I don't have any idea.
Okay.
But in generally, I'm not satisfied.
Okay, you're not satisfied, but you don't know why. Okay.
Yes.
Right. Okay. Okay. To be satisfied, I mean, basically, we look at we look at the yourself and the patient. Okay. So the patient had a problem. Did you solve the problem?
Yes, of course.
Okay, so you addressed the patient's problem.
Yes.
And was this the same as what they were expecting?
Yes. the expecting is to manage the constipation,
Right.
and I try to address about this problem, this concern.
Okay, and this is your agenda. Okay, you think that okay, this patient is here because of constipation, and because of constipation, I'm treating it. Okay, now
Yes.
this is your perspective, but the patient's perspective is okay. One of them, she said, or he said, why do they prescribe such medicines when they are so constipating? Okay, and you said, well, don't worry about that. Okay, don't worry about that. Then
I shouldn't say that.
I'll tell you now. And the other question was, is that because she hasn't been eating enough? Okay. And the other thing was, what could we, or what should we do? What should we do for the constipation now? Any medicines? Okay. So there were 3 cues. Okay. So why do they prescribe such medicines? The patient is annoyed when they are so constipating. Okay. So you need to address that. That's a cue. You need to say, well, I can't say why, but it has been prescribed anyway. Maybe the person who prescribed it thought that this is necessary because she's been in pain. Jessica has been in pain. For pain control, they have given this. Okay. But yes, what they could have done is actually to give you advice to reduce it as much as possible, to cut down and to use as little as possible rather than giving it regularly. Okay.
Yes.
So that's an idea, okay, and concern. Basically, she says it's a concern. I'm worried. Why do they prescribe this? I asked the question. I said, is that because she hasn't been eating enough? You never answered that. Okay.
Yes, but
you said it's because of the tablet. Okay.
No, in my role play, it's not speaking about eating enough.
Yes, but you need to listen to the patient. Okay. Yes.
Yes.
Okay.
Excuse me.
Yeah. So I asked the question. I said, "Is that because she hasn't been eating enough?" You can say not much, or maybe yes. But not exactly. It is also because of the medications. Okay. Should we do? What should we do for constipation now? Could we give her any medicines? And you said no. Yes. Did you give it?
It's not necessary.
It's not necessary. Why? Okay. Because
it will go away after a few days.
Yeah,
for
it
example.
will. Yeah. So because the constipation goes away in a few days. Okay. Just give more fluids. Okay, you said that. Okay. Just
this is temporary change.
That's right.
This is
And you said it's a short acting analgesic. So you said it has a short half life. Okay. So
I think the short half life is a medical jargon, and I try to not use of them.
Yes, you can say it is actually yeah. This tablet.
Short acting is I think it's a common.
They can understand that this tablet is short acting or is it's you can say it wears off quickly. Okay,
Okay.
it wears off quickly. Okay, so uh, so the other thing I think you weren't feeling confident here when you were giving information. Okay, you were saying that. So, uh, what could we do with systematic information giving? Okay. If you try that, if you say, now we want to say, well, uh, this is constipation due to oxycodone. Okay, due to the tablet. Okay, so
Yes.
that's the etiology. Okay, so what should I say next? It is
They examine for rule out of other.
yes. Okay, and so she does not have any uh, mm, worrying signs. Okay, and she is well. Okay, so basically you have examined her. She's well. She doesn't have any worrying signs. Like if she doesn't pass any wind or if she feels sick, then we take it as it is something more serious. Okay,
Okay.
so you can explain that if she doesn't pass wind or if she vomits, that is potentially serious or significant. Okay.
Yes.
Okay. So no. So after that, we say, okay, what we can do. Also, the management, what we can do, and what will happen. Okay. The prognosis. What we can do is okay. So we give options. We say, well, what we can do is, well, to wait and see. And another option is to give her more fluids and to encourage her eating. And also, there are medicines available, but I don't think that's a good idea now. Okay,
Yes.
so that's we say we gift wrap it. We say it's like میگن کاغذ کادو میپیچیم gift wrapping. We say, well, and you give it as the last option, and you say this is the last option. There are some medicines, but I don't think it's a good idea now, or I don't think they're necessary. Uh,
Okay.
okay. So what we can do is, so the simplest thing is nothing. Okay. What we
Yes.
can do is do nothing. Encourage fluids. Okay, so the most important is stop the medicine that you said and give paracetamol instead. And do nothing, encourage fluids, encourage food. Okay.
Yes.
And
Fresh fruit.
yep,
Fresh fruits or fiber. Yes.
good.
Vegetables.
Yep.
Don't eat well. Yes. Don't eat.
Uh,
She doesn't.
she hasn't been able to eat enough, basically, or
Okay.
because
Yeah.
of pain. No, and then what we can do, we can say that, well, there are some medications,
But
but I don't think it's a good idea. What I don't think they are necessary now.
at this stage.
Yeah, yeah, at this stage. Okay,
Yes.
good. So what will happen later? Then you will say, well, what will happen?
Hopefully,
Yeah,
hopefully,
it will clear
it will clear
in a few days. Okay.
in a few days. Okay.
Right. So, what did I do? Basically, your diagnosis or your opinion, etiology, what we can do, the management, and what happens next. Okay, so that's with a systematic approach, you can
Yes.
actually
Treatment and prognosis. Yes.
okay. So just suppose you want to teach a layperson in 1 to 2 minutes. Okay, just think how you would say this, and you can use that for more common scenarios. Okay, for any common presentation by
Okay.
patients. So you can say that for coughing, for fever, for diarrhea and vomiting, for constipation, anything. Okay.
Okay.
Right. If she doesn't, okay. So basically, I think the reason you weren't very happy was because of the last part, which you were actually and you were a bit struggling to give information, I think. But you did actually, you did well. I think you deserve more than 6, maybe 7 or 8. But
Thank you.
but yeah, the previous one was better. But okay. Some grammatical points. Apart from constipation, okay, not apart. You said apart constipation. We don't say apart constipation. We say apart from constipation. Okay.
Apart from, yes.
All right. Okay. So yeah, you said don't worry. It is resolved. Or it resolves in a few days. You said something like that. The
Yes, I
constipation.
think.
Okay. It is resolved, or it will be resolved. Okay. Well, in a few days. Well, we don't say it is resolved because it is, and then it's a fact. Okay. You're predicting, you say it will be resolved in a few days. And sometimes we could actually say it's probably better to say it would be resolved or it would resolve in a few days. In a few days, okay. Now, the reason I'm saying that is because you're not 100% sure, okay? And there's a different meaning here in English. But there's difference between it will and it would. Oh, I wrote it twice.
Yes, twice.
Okay, so it will be. It means it is certain. I'm certain. I'm sure. You can say I'm pretty sure it will resolve or it will be resolved. Okay.
Yes.
It's better to use, I think resolve means to get better, to become better. So you don't have to make it passive. So you can say, I'm sure, or I'm pretty sure it resolves in a few days. Or you can say, I'm quite hopeful, or I'm quite optimistic that it would resolve in a few days. Okay.
Yes.
Okay. So when you say would, it means it probably you put some margin of error. You said a short half-life of this tablet. We discussed that. It can heal. Okay, you said it can heal.
No. It can be healed. It can be healed.
What do you mean it can heal?
heal بهبود یافتن میتونه بهبود پیدا بکنه.
Okay, but about constipation, you said it can heal.
No.
No.
It can be healed میشه. No.
Well, usually an ulcer or kind of a wound
heal.
heals. Okay.
Okay.
But yeah, for constipation, what do we say? It will
Get better or get better, go away, disappear. Okay.
okay. Yep. Constipation. It will improve, or it will be better, or it will go away on its own.
Yes.
On its own. Okay. So we don't have to do anything. The constipation will be better on its own. Will go away on its own. Okay.
Okay.
So any okay, and you said the paracetamol doesn't have any side effects. Is that true?
Yes.
Or paracetamol cetamol is a pretty safe painkiller with little side effects. Okay. Right. You know, we need to be precise. If you say it doesn't have any side effects, this is wrong. Okay. And if you say it is a safe painkiller, no, it is wrong. It's a rather safe, or it's a pretty safe or relatively safe painkiller with little side effects. Okay. Now you need to. I mean, this is. They will actually teach you these later in GP. GP education and training, but you cannot say something which is not accurate. Okay, as a professional, you're expected to use accurate language. So you should say, you can never say it is safe, it doesn't have any side effects. You cannot say that. It does have side effects, but very little side effects, or rare side effects, or it is very unlikely. You can never say never. Okay? Is that all right?
No, excuse me. I didn't catch that. Please, please repeat again. Excuse me.
Okay. This is a wrong and inaccurate sentence. Okay.
Yes.
Okay. Because you cannot say that a medicine has no side effects. Okay. Instead, you said paracetamol is a pretty safe painkiller with very little side effects. Okay. It
Okay.
means nearly nothing. Okay. Instead of no side effects, we just say little side effects.
Okay. Excuse me. About any side effect, what do you mean about what's the wrong? Why is wrong?
It is inaccurate. Paracetamol does have side effects.
پلیز فارسی متوجه نمیشم.
شما میگین پاراسیتامول هیچ ساید افکتی نداره.
بله.
اوکی.
درسته.
همه داروها ساید افکت دارن. اوکی.
آها. اوکی. آها. اوکی.
این این چیز صحیحی نیست که شما بگید که این دارو هیچ ساید افکتی نداره. اوکی.
اوکی. فکر کردم گرامری هستن رو شما دارین روی گرامری عینی دارین صحبت می‌کنید.
نه روی مفهوم
متوجه شدم.
اوکی.
بله متوجه شدم.
These are the side effects. Okay.
Yes. Yes. Okay.
Okay. So گفتم که بعداً توی جی پی ترینینگ هم بهتون خواهند گفت و روی این تاکید میکنن که شما وقتی صحبت میکنید باید سعی کنید که اکورت صحبت کنید به عنوان پروفشنال. اگه شما بگید paracetamol doesn't have any side effects, that is a wrong utterance. Okay, you should say it has little side effects, or it is very unlikely. You cannot say it doesn't cause any side effects. It is very unlikely to cause any side effects. Okay,
Okay.
and
Okay.
it's not constipating. Okay.
Yes, of course. Thank you.
Okay.